I'm Sandrina Tian, founder of MisguidedNotions.com, your health and wellness resource to help you or a loved one who may be struggling due to illness. Thank you so much for tuning in today. I really wanted to take this opportunity to talk about navigating a loved one's care during COVID. Let's face it, right now, everyone is super overwhelmed. People are stressed out. But it's not only people that are struggling with COVID. There's other people that have chronic illnesses that need help and need care. And I've been finding that a lot of my patients have been very concerned at the idea of not being able to visit their doctors the way that they normally have because we are practicing social distancing. So in this video, I'm going to offer tips and some guidance on ways to go about getting in touch with your various medical providers to help you or a loved one. First things first, I want to talk to you about telehealth visits, also known as telemedicine visits. You can actually set up virtual visits with your various medical providers. CMS, aka the Center for Medicare and Medicaid Services, has temporarily put in place a federal law that indicates that medical providers across various disciplines are able to bill utilizing audio and visual formats. I want you to think about this a little bit. So remember that old tablet or cell phone you have lying around, the one that you're not currently using? What you could do is offer that to a loved one because they can utilize this to have conversations with their doctors and have visits. And just like traditional office visits, now what they're doing rather, in light of COVID-19, you are able to have a face-to-face with your medical provider, and that includes medical doctors, physician assistants, nurse practitioners, registered nurses, licensed clinical social workers, and so on and so on and so on. And again, they are able to schedule visits with you using this virtual format. Now, what if your loved one isn't necessarily tech savvy? Well, I have an option for that. Remember I said the audio aspect of the visits? Basically that means is telephonic visits are also billable under this new temporary federal law that passed. I'll be sure to link that in the notes so that you can have that as a reference. But I strongly encourage you to check with your insurance provider or carrier just to make sure that you are going in according to a provider within your network. Speaking of old tablets and smartphones, now it's great if you have access to them or you can provide your loved one with that access. However, you're going to need data in order for it to function properly. So I am encouraging everyone to call your cell phone provider or other internet carrier that you utilize to see if they're offering any specials given the current pandemic. Believe it or not, recently I was actually able to assist my client in calling her cell phone carrier, which I will not mention the name, but they offered to give her free data up until May 13th. So she got like a little bit over a month of free data because we called and asked, and she doesn't have to pay for it. And she was super stressed and worried about having to have this added on bill. So I definitely encourage you to look into that because that may be a possible option. This brings me to my last and final point. House calls providers. Do you know that there are actually house call providers that visit you within your home? That is an option for people. You should definitely call your insurance carrier to find out if that is an option, because there are certain things that you can't necessarily depend on a virtual visit to do. Like if you need some sort of assessment, particularly your loved one who is dealing with chronic illness, especially if they're elderly, it might be very difficult for you to depend on virtual visits. So let's say you want them to be seen by someone, it may be worth it to explore and see if your insurance carrier would cover a visiting medical provider. In addition to that, if your loved one has recently been hospitalized, it might be worth it to explore and find out if they're eligible for some sort of transitional care team. And that's where they have a set of team members. It's usually focused in an interdisciplinary format where it's a nurse practitioner, a nurse, sometimes a social worker, and they're all in charge of your care, just giving you some sort of guidance and serving as a resource, and most importantly, to help you stay home and be healthy and not have to go into the hospital or go to the ER. So with all of that, I hope that you have found this information helpful. I know with COVID-19, it has been a huge stress for a lot of people. We're still trying to navigate it as much as possible. I'm currently in New York, and we are literally in a hot spot, and it's so overwhelming for all of us here, and I hope that you all are being safe, and please, 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 please wash those hands. Thank you so much for watching. Stay tuned for the next video, and if you like this video, please be sure to give it a thumbs up, like it, and please subscribe to my channel. Thank you.